All right, guys. So we got to talk about the Take Care of Maya trial. All right. So we're going to take a look at the opening statements, and then I think one of the social workers is what we're going to take a look at after that. All right.
Plaintiffs will prove that from July 7th, 2015 through January 13th, 2017, Johns Hopkins missed a diagnosis of complex regional pain syndrome on 7 different occasions when Maya was in for their care. We will prove that they misdiagnosed Maya's symptoms from October 7th through the end of the year, wrongfully accusing Beata and Jack Kowalski of child abuse, and alleging and attempting to show that Maya had a mental disorder, that she was crazy. She was making it up. We'll prove that they realized their error pretty quickly, and instead of apologizing, saying we're sorry. Upon realizing their error, for the next 3.5 months, they took every step in the world to attempt to force the Kowalskis to agree with the wrongful diagnosis. Maya Kowalski was falsely imprisoned and battered. She was denied communication with her family. She was denied communication with the outside. She was told that her mother was crazy. She was told by social workers that, one in particular, she would be her mother. She was put into a room and left for 42 hours with the commode just out of reach, because the hospital wanted to prove that she could actually get up and walk. So they wanted her on video, this is a surveillance room, to get out of bed and then go over to the commode when nobody was watching. Instead, she defecated on herself.
Now, y'all look. From everything I've heard so far, my overall opinion right now is everything they accused the family of doing, they turned around and did themselves. They accused them of brainwashing their daughter. And so what did they do? They tried to brainwash their daughter. You know what I'm saying? Trying to say that your mom is just, doing this on purpose. There's nothing really wrong with you. Like, if you're going to take it to that extreme, you better be right. And that's the whole thing. You know what I'm saying? Let's just imagine for a moment. If you had a friend, let's imagine you wanted to take their kids, right? You wanted their kids to be your kids. And so what you did was you went and filed reports saying that, they're making their daughter sick, they're brainwashing their daughter, they're doing all this other stuff, and it's all bogus. Shouldn't you get in trouble for that? Because you've now caused, hardship on that family. You've caused, social workers to have to come and get involved with that family. Uh, you've caused a whole lot of stuff that it was all based on bogus reports. So, yes, you should get criminally charged for that, in my opinion. So, how is it then that a hospital can do that and there's no criminal charges? So, we're also going to do some actual research into Munchausen by proxy. All right. because that was the main, you know, thing that sounded the alarms for them, right? And to my knowledge, there's two ways of going about that. There's psychological, and then there is physical, right? The physical aspect of it should have been pretty easy to diagnose or to rule it out, all right? And the way you would do that is you would talk to a few different doctors, people who specialize in this field, and ask them, what type of uh, chemical, toxin, or anything else could cause these symptoms. So then you would start running tests and you would be looking for anything that could cause those symptoms. All right. And at some point, if there's nothing in her system to suggest that she's been poisoned with anything, then you move on to psychological. And for that, you would bring in actual psychiatrists and psychologists or whoever else, right? And then you would have them do some psych evals. And I think that is where they really went wrong. All right. I don't know if they actually got independent sources to do some psych evals on the family and on Maya specifically. All right. But it sounds like they just relied on the caseworkers. You know what I'm saying? And that is just not good enough. And so I know the caseworker called some of her other doctors, right? And they still proceeded with the allegations. That sets off some huge red flags for me. All right. Because the mother's requests for the medication, for procedures, or whatever else was based on what the doctors had told them. All right. You know, I could see them saying neglect if the mother hadn't mentioned anything at all about the doctor's, medications he prescribed or diagnosis that he put on her charts or anything like that. Then I could start to see, it looks like she's trying to, hide this stuff from us, where we need to know what her previous treatments have been and what exactly she's been diagnosed with. And what they kept wanting to do was to point the finger at the parents or at the mother specifically, um, because of the treatments that she was receiving. But if you really wanted to, say that the treatments were unorthodox and that they were dangerous or whatever else, you don't need to be pointing your finger at the parents or the mother. You need to be pointing your fingers at the previous doctors. You need to be calling other specialists and get a second opinion from an independent source and let them come in and then let them tell you what they think might be going on with Maya. Run different tests, look at her charts, see what tests have been done, and go from there. If one doctor says she has CRPS, then find other specialists that know about that and then get their opinion. Does this fit CRPS? And if so, then do these treatments actually make sense for a patient like Maya?
For 42 hours, she was kept in that room, denied access to anyone or anything. under the false assertion that it was an EEG exam. Maya was repeatedly battered by nurses and social workers who were trying to prove that she did not have CRPS. Things were done such as coming in and patting her on her leg. They were hugging her against her will, took her down to the chapel, sat her on the lap of one named Kathy Beatty, who told her that she would be her mother. Her mother was, crazy, and that she needed a mother, and that social worker would be there. Maya was kept from her family and friends. She was denied access to her priest. She had what they called religious artifacts, such as holy water, her prayer book, her rosaries taken from her on the belief that her mother was controlling her over religion. She was denied access to counsel, at least insofar as having the ability to actually meet with her attorney without people listening in at the door.
Now, like I said, there's so many red flags. And the religion part of it, that is beyond ridiculous. And what it leads me to question is, what about all the other families that has, gotten help from this hospital? Are there any other reports like this from families who, actually didn't do anything wrong? And I think I heard somewhere that there was a lot of other families that had problems with this hospital, but I don't remember for sure. All right. So I could be mistaken about that.
All of her phone calls were monitored. Her iPad, computer were taken away because she was told she might be, this is a 10-year-old, cruising internet sex sites. Maya was denied the comforts of her friends and her family throughout her stay there. On another occasion, again, to try to show that Maya did not have rather significant symptoms of CRPS, which you'll see are these small little red, angry lesions that appear on different parts of the body, underneath the arm, along the arms, sometimes on the legs, sometimes on the back. And you'll see photos here in a moment. But in order to prove that she didn't have one, she was systematically stripped and photographed against her will and without any authorization from anyone, least of all her parents. They continue to accuse the Kowalskis, Jack and Beata, of being child abusers, even after the evidence, we believe you'll conclude, was overwhelming that she had CRPS. In fact, we will see whether at some point they even admit she had CRPS in this case. Yet they still, throughout this period of time, continue to accuse Beata of child abuse and Jack of child abuse, something called Munchausen by proxy, which means that you're intentionally trying to keep your child ill. It's usually a circumstance with a very small child where a mother will be putting something in an IV or things like that. And Maya, at this time, was 10 years old. There is no evidence whatsoever of Munchausen by proxy. By January 13th, when Maya was finally left out of the hospital, unsurprisingly, this family was a wreck. Maya was not let out of the hospital even after her mother committed suicide on January 7th of 2017. Now, the story with Beata Kowalski is a complex one, and I'll tell you about it in a moment. But we will prove that the continued allegations that she was crazy and that she was trying to harm her own children, both Kyle and Maya, and the knowledge of the systematic abuse of her child in the hospital caused her, at the end, to lose completely and utterly her ability to control the maternal instinct, and that outweighed the survival instinct. In the process, they caused 𝕝𝕜 𝕠𝕦𝕥 her life, denied Jack a loving wife, denied both Kyle and Maya a loving, caring, and amazing mother. They caused just terrific and permanent psychological injury, as one may expect, a permanent aggravation, and we'll explain the medicine behind that, of the CRPS. Now, the CRPS didn't start with Johns Hopkins. It started about 3 or 4 days before Johns Hopkins. But the evidence will show that something that could have been a controllable, manageable disease was aggravated to the point where throughout periods in her life she will be incapacitated. And through all of it, she and her brother and her father will have post-traumatic issues and problems that will, frankly, we'll get into that in a moment.
So here's what I'm thinking about. What treatments or medications is she taking right now? Is she still taking the ketamine? I believe that's what it was, ketamine. So is she still receiving high dosages of that? Or, because as of right now, like, she's able to get up and walk around. But of course, it is intermittent. All right. I did watch some of her brother's testimony, and, but they never did address, what treatment she's receiving at this time. I'm like really glad that she's doing better. All right. I just wish her mom was around to see it. You know what I'm saying? This is the part that's really messed me up, because I just could not imagine something like this causing her to just give up. But later on, I come to understand why it happened. Because her mom came to the realization that they were never going to get her back as long as she was around. And the only thing I could say is I hope that wouldn't have been true. Right.
We've asked in this case for you to consider not only compensatory damages to try to make them whole for these terrible things that have happened to them, but also punitive damages to deter them, to punish them, and to deter this type of behavior in the future. So some of the evidence here will be directed towards that. So that's the overview of what we're trying to do. Now, how are we going to do it? First, you understand that we have really 4 plaintiffs here. We have Maya Kowalski right here. We have Kyle Kowalski, and we have Jack Kowalski. And Jack's also the parent and guardian of both of them, right? So the claims go through him. And then he has independent actions himself. And he's also appearing for the estate of his deceased wife, 𝕝𝕜. And each of them have causes of action, some of them combined. Now, this historic case has been going on. It was filed in October 2018. I tell you this because the key facts in the case began several years before. But through the course of time, we've taken an immense number of depositions. We have found audio tapes, videotapes, surveillance tapes, a lot of evidence for you to review towards proving these allegations. The core claims, again, are medical malpractice, which is that the defendants failed to meet the standard of care, and we will prove that through expert witnesses, that they failed to identify CRPS, which is also known, by the way, as RSD, is the older name, reflex sympathetic dystrophy, now known as CRPS. Okay? They failed to identify it at first, and then they misdiagnosed it, and then once misdiagnosing it and realizing they misdiagnosed it, the evidence will prove they went about a system to try to get the Kowalskis to admit they were right. Battery, I've talked about. False imprisonment of Maya on multiple occasions. Intentional infliction of emotional distress is where you do things so outrageous that they cause damage and injury to a person. In this case, a suicide. In this case, traumatic disorders, depression, a multitude of emotional problems and issues. We've alleged fraud in that they intentionally deceived or attempted to deceive in the proof of the matter. We also alleged fraud in that they billed $536,000 for the treatment of CRPS and yet never treated her for CRPS, and took multiple positions, especially to them, especially to Maya, that she did not have CRPS. Yet they billed over $500,000 to the healthcare provider and the Kowalskis for the treatment of it. There's no clue at this point. So, as part of the treatment, they suggest that Maya be taken somewhere else, TGH, Tampa General Hospital, for therapy. They thought maybe physical therapy would help the child. And as part of that transfer process, they sent Maya's history and physical notes to TGH, and then had a phone call informing them that they thought this might be conversion disorder, this might be mental. So the first time any of these other doctors heard anything about Maya Kowalski, it was with an initial possible diagnosis that it was all in her head. The child couldn't walk.
All right, guys. So I'm not too familiar with conversion disorder, all right? But just because they may be looking for psychological disorders, all right, doesn't mean that they're saying this is all in her head like it's imagined or it's made up. You know what I'm saying? This could be a misunderstanding on their part, all right? So, psychosomatic disorder, which is something I actually have, is a very simple disorder. Basically means you have physical symptoms that are derived from emotional, like anxiety, depression, things like that. All right. Doesn't mean it's just all in your head, it's imagined or anything like that. It's just describing the origin of the symptoms. You know, and as a matter of fact, I've actually asked my doctors about that diagnosis. You know, and I said, is that trying to say that it's just made up, that it's not real? And they said, absolutely not. Like that's what it sounds like it's saying, but that's not what the diagnosis is saying. All right. You know, but once I actually start looking into conversion disorders, then I'll know more. But as of right now, I don't know enough about what conversion disorder actually is. All right.
And certain symptoms were coming to the forefront by this point. Now, because Johns Hopkins couldn't figure out what the heck was happening, Maya was taken by Jack and Beata back up to Lurie's Children's Hospital in Chicago. Now, this is her former home. It was a familiar place. Lurie's had treated Maya for this asthma previously. They thought, well, let's take him back and get a second opinion. And so, and Johns Hopkins was aware that patients were going to seek a second opinion and contacted and talked to them about their theories. The doctors in Chicago couldn't figure out what was going on either. So Jack and 𝕝𝕜 proceeded with Johns Hopkins' recommendation to take him to Tampa General. Again, the doctors in Chicago thought, well, it could be steroid myopathy, it could be generalized muscle weakness, or maybe it's all in her head, but nobody made a diagnosis of that. She went to Tampa General Hospital, and TGH, as I said, already had Johns Hopkins records. Now keep this in mind. Either. So Jack and 𝕝𝕜 proceeded with Johns Hopkins' recommendation to take him to Tampa General. Again, the doctors in Chicago thought, well, it could be steroid myopathy, it could be generalized muscle weakness, or maybe it's all in her head, but nobody made a diagnosis of that.
Now, what my question is, did they actually say those specific words? Or did they say, or maybe it's conversion disorder? All right, so that's what my question is, because we need specifics.
She went to Tampa General Hospital, and TGH, as I said, already had Johns Hopkins records. Now keep this in mind. Facts will show they already had the records. They already talked to them about what Johns Hopkins thought. All right, so Maya had inpatient comprehensive pediatric rehab and physical therapy and occupational therapy for the steroid myopathy. Now, the reason this is important is that there are certain treatments that you get for CRPS before you start ramping up on some of the medicines that are used. So you want to see if the most basic types of therapies can bring somebody around to lower it to the point where it's livable. CRPS never goes away. It is a permanent disease. It's merely controlled. But before you graduate on to more advanced treatments, you want to go through the basics. And fortunately, they had the idea of trying PT and OT, but they did not spot that it was CRPS either. They still went with Johns Hopkins theory, that it was steroid myopathy and that maybe there might be some psychological overlay. Again, they missed it. She was evaluated for adrenal insufficiency, inpatient treatment for mood and disorder. She's given Valium and Prozac. Again, this is a 9-year-old girl, 10-year-old girl. Hospital alluded to Maya or 𝕝𝕜 falsifying or exaggerating a fall from her bed, and missed several complaints, although they documented several indications of CRPS. However, at that point, she was there for 4 weeks, and as the discharge diagnosis says, history of steroid-induced myopathy, noted as resolved by admission, gait disorder, impaired mobility, ADL, asthma, psychological factor affecting physical condition, conversion disorder versus factitious disorder versus others, anxiety disorder, myalgia. Now, importantly here, you'll see that it says resolved by admission. Well, we're going to bring in the actual physical therapist that treated her. And you will find throughout this case, the facts will show that there will be a distinct difference between what the actual people who were hands-on treating Maya had to say about how she was doing and whether she's progressing of CRPS. However, at that point, she was there for 4 weeks, and as the discharge diagnosis says, history of steroid-induced myopathy, noted as resolved by admission, gait disorder, impaired mobility, ADL, asthma, psychological factor affecting physical condition, conversion disorder versus factitious disorder versus others, anxiety disorder, myalgia. Now, importantly here, you'll see that it says resolved by admission. Well, we're going to bring in the actual physical therapist that treated her.
Now, y'all look, I really liked the physical therapist. All right. That was the first part I actually saw when I started getting interested in this case. All right. As soon as I turned it on, there was the physical therapist, and they were reviewing one of the videos, you know what I'm saying, of her trying to help Maya. All right. So, I think she was doing a phenomenal job. You know what I'm saying? And I did watch her testimony, all right? And it seems like the hospital really should have listened to her, and they didn't.
You'll find throughout this case, the facts will show that there will be a distinct difference between what the actual people who were hands-on treating Maya had to say about how she was doing and whether she's progressing, and what was put down in the medical records. The Tampa General Hospital visit was very difficult for her. At this point, she was displaying what is known as dystonia. Dystonia is where the ligaments in it could be anywhere, but in this case, in her ankles and feet, were contracting to the point where her feet were starting to turn in like this. This is a clear indication of CRPS. Tampa General Hospital thought that maybe they should put some boots on her and see if that would correct her feet turning in. And we'll have some video from the physical therapist that shows Maya attempting to walk in those boots, Maya attempting over and over again with things like trying to push her leg and saying, "Giddy up, horsey." Again, remember, it's a 9-year-old girl. And demonstrating she was trying as hard as she could to walk. The evidence will show throughout this, Maya did not want to be in a wheelchair. She did not want to be one of the kids that was looking out the window while all the other kids were playing. But Maya kept getting worse, not better. And she was still in pain. And when school starts in 2017, 15, she says she was still in pain throughout her body, and she would moan and scream in time in panic. And she kept getting weaker, and weaker. Now, Maya was in and out of Johns Hopkins throughout this period of time. Okay? And there was prescriptions for opioids, again, physical therapy, occupational therapy. Nothing was working. No one had any answers. And then a patient of Beata's, one of the infusion nurse patients, said, "This may be CRPS. I have a daughter with it, I believe. Why don't you look into seeing this?" And there are doctors here in Tampa Bay area that are specialists in this. And so she went to see Dr. Anthony Kirkpatrick at the RSD Foundation, Reflex Sympathetic Dystrophy Foundation. Now, to diagnose complex regional pain syndrome, the Budapest criteria for CRPS gives us certain specific symptoms, diagnostic criteria: persistent burning in the arms, hands, legs, feet, or another part of the body. Check. Multiple medical records will show she had that. Pain can be mild or severe. We have actual audio recordings of Maya moaning. You'll see and hear the child and can determine whether or not she was in pain. Swelling, sweating, all of those. Dramatic changes in skin color and skin temperature. Testimony is that Maya was constantly too hot or too cold. Now, people get too hot and too cold all the time, but usually they're not 9 or 10-year-old children, to the point where they're either shivering and need a blanket, and then 2 hours later are wondering, why is it so hot in here? That kind of temperature change. And of course, then blurred vision, which is already appearing in the records, dystonia, again, the movement disorder like this, and then a really confusing symptom called allodynia, which is an extreme but often inexplicable sensitivity to touch. It means that on some occasions, you could come up and squeeze Maya's arm or touch her legs and get no reaction at all. And at other times, just the thought of someone coming up to her and putting their hand near her as though they were going to touch her would give off an incredible reaction: screaming, yelling, resistance to anyone even touching her. Reason? That because of the RSD, CRPS, she would feel extraordinary pain as a result. But it doesn't happen all the time, and it doesn't mean that when you don't have it, you're not in pain. One of the experts will testify that this is sort of like, think about it as a cancer patient or someone with an intermittent disease. You may be in remission and be doing fine and look fine to everybody outside. You may be hurting like crazy on the inside, but outside you look pretty good. And then other times you may be curled up in a fetal position and not be able to walk, talk, or move. Also a light sensitivity. Interestingly, the Budapest criteria, which are kind of the accepted criteria for CRPS, are also listed by Johns Hopkins as their diagnostic criteria for CRPS, right? So she goes and sees Anthony Kirkpatrick, Dr. Kirkpatrick, who you'll meet. Now, notice on the photograph, see the feet there turned in? Notice the lack of muscle mass on the legs. She's in a wheelchair, obviously, and that's sort of a attempted smile, but she's got sunglasses on. Now, why is the child wearing sunglasses inside at the doctor's office? Because she has a sensitivity to light caused by the CRPS. So Dr. Kirkpatrick went over the entire full history, list of symptoms and therapies tried. He did objective testing, including pain threshold test, range of motion test. We'll actually have the videos from before and after, where you can see that before the treatments she eventually had, and are part of the issues in this case, she could barely get her arm up to here, and then you'll see after the therapies that they ultimately complained about, that she can put her hand completely over the other side. And the diagnosis was CRPS. Now, Dr. Kirkpatrick did not say, all right, let's just go into some heavy duty pain meds or anything else. Again, he said, let's try some physical therapy and what is known as warm water therapy, which is essentially where you use a very warm pool or bath or something and you do it in there to loosen up the muscles. A little different, but again, physical therapy. He did not recommend out of the box any sort of pain meds. That didn't work, and that's when he introduced them to a revolutionary use of an old drug called ketamine, and the ability to break the chain. See, CRPS involves a problem in the pathways between the pain sensors in different parts of the body and the brain. Usually when someone injures themselves, you sprain a finger or something, out, it hurts like heck. But over time, right, it starts hurting less and less and less, and pretty soon after a while you just kind of forget about it. That doesn't happen with CRPS. Because of a problem as yet not understood, which is why we don't have any cure, the pain relay, the circle, the loop here of feedback is getting bigger and bigger and bigger, until what was once a tiny little fracture or a tiny little sprain or whatever you want to call it turns into something that is the worst pain known to medical science. I'll talk about that in a moment. And ketamine, which has been around since the 1950s, it's FDA approved. It's used mostly as an anesthetic, and it's not an opioid. It doesn't work like an opioid. But for some reason, not fully understood, it breaks this feedback loop, and people start getting better. Not all of them, but a very high percentage get better. So there's actually, I think, do we have the audio on this? So this is one of the initial visits with Dr. Kirkpatrick discussing the use of the ketamine infusions. And I want you to concentrate on what this mom, who's also a nurse, is asking about.
Who in your practice administers the ketamine?
I do.
You do, okay.
And I'm ACLS certified also. I have to be. To do
Yeah, you
kids.
have to be.
Well, PALS, you got to have the PALS and all that stuff.
CLS, yeah.
And we have a pediatric code card back there. You know, we have to do all that stuff if we're going to do
Good.
children.
Absolutely.
Yeah.
That was my next
They're-
question.
they're
Do you
told-
have a pediatric crash cart?
No, we have to,
Yeah.
you know, I mean, that's a standard of care. You have to.
Now, Beata knew all about how to keep her daughter healthy, not this disease, but how to keep her daughter healthy and how to protect her daughter. And notice in there, one of the first things she asked about, is there an ACLS crash cart? Are there all the different equipments that you might need, even during an infusion, because remember, she's an infusion nurse, in case anything could go wrong. Now, here's the McGill, pain scale. This is interesting. I had no idea until I reviewed this. But, I'm sorry, this right here, as you can see, this goes over, and this was developed in Australia. It's been around for a long, long time. It's adopted by about every hospital, every medical association. And this describes the different pain levels according to description by patients and every other objective finding that one can make. And you'll see at the top that CRPS is the most painful. It was actually developed at the University of Montreal, Canada, by Dr. Lasco, I guess, and most of the clinical trials were, I believe, in Australia. Symptoms of CRPS, we've gone over those. It strikes mostly females in the population between the ages of 7 and 21. It is known for initial symptoms that are inexplicable. However, upon close review and a differential diagnosis to rule out other things and consider neurological disorders, this is one of them. And if you can identify a few of these symptoms, our experts will say CRPS should have been brought into the mix very quickly. That did not happen here. All right, so from October 6th through 8th, she has her first ketamine infusion with Dr. Kirkpatrick, a follow-up, and the first infusion went well and helped to get Maya out of pain, and there was a lot of encouragement over that. He wasn't pushing for more ketamine, he's simply trying to instruct on a conservative approach, warm water therapy, let's try the ketamine again. They tried it again, and again, got some good relief, but not for very long. Maybe for a week, 10 days. But not what they were looking for, to bring this child back to being a normal kid, right? So, at this point, Dr. Kirkpatrick says, well, she might need more and frequent of these infusions, so why don't you go over to Johns Hopkins and visit for a PICC line placement? And so, on November 4th, she goes back to Johns Hopkins for a PICC line placement, and the diagnosis over there accepted is CRPS. And so Johns Hopkins itself does the PICC line. PICC line is it's basically a tube that's put in so you can do the infusions a lot easier without trying to find a vein. All right, so, and she begins therapy because, again, everybody wants to find out, is this really anything exaggerated by Maya? Is there a psychological component to this? Let's just make sure. So Maya starts with a therapist by the name of Rebecca Johnson, and I believe you'll hear from Ms. Johnson or Michelle Rogers, who is her partner there, about those. Maya was never determined to have any type of conversion disorder or factitious disorder by any psychiatrist or psychologist, except that as part of CRPS, there can be certain symptoms of conversion, which is, how do you explain this? The feelings of pain become so exaggerated, this allodynia, that the patient is anticipating pain before it actually happens. So she goes and has the therapy, but still nothing is working and nothing is really getting her out of the extreme pain on a long-term basis. So Dr. Kirkpatrick, and you'll hear from Dr. Kirkpatrick here to explain all of this. Unfortunately, in the United States, the procedure that had been shown to work the best for intractable CRPS, long-term ketamine infusion under general anesthesia, a medical coma for 3, 4, 5 days. is not performed in the United States. It's performed in Germany. It's performed in Mexico. It had been around since approximately the 1990s. It had essentially 100% rate of safety, that is, no one had ever died from it, and it had a very high rate of success. There is a physician, a University of Texas trained anesthesiologist, Dr. Fernando Cantu, who's going to fly here from Mexico to describe the process. And it involves, again, infusions of ketamine over a very long period of time, the idea being that it causes the brain to reset so that you don't have this feedback loop causing the pain. The first one, in late November, 19th through the 23rd, there is a high-dose infusion, and what do you know? The lesions begin to heal, and there's a slight less turning out of the feet. And yet the pain was still not where they wanted it. So Maya stayed there, and then on November 19th through the 23rd, she went through another high-dose ketamine infusion. Now, during this period of time, other than during the middle of the infusion process, there were absolutely no negative signs from Maya. She had a brief increase in her liver function results, but only, we're talking, for a matter of hours. And as soon as the ketamine infusion was done, they went right back. And it's important to note that other than at that time, and through all of her ketamine treatments, Maya's liver functions, which is the things you look at if you've got a medication like this and you want to see, is it hurting somebody? You look at the liver functions, and her liver functions have stayed normal throughout. And you'll see the medical records to show that. All right. So then, a miracle. By December 28th, Maya's lesions are noticeably less. Her feet are starting to not be as turned out. In fact, by the end of January, and we'll show you the films, she's actually able to get back in the pool. You can see a picture of her here in, I believe, late January. And this is her. You'll notice the feet looking better. She's on Kyle's shoulders there. You'll notice a real smile coming up. She's able to do her warm water therapy. But she still is having some pain. And the idea here was to get this kid out of the wheelchair, right? They wanted to get her out of the wheelchair. And to get her out of the wheelchair, they really needed to get the feet totally back, and they needed to get the pain levels back so it wasn't so painful when she walked, so she could build up her legs. That was the idea. So they go back to Johns Hopkins, okay? All right. Central port means there's an operation, and there's the note. Placement implanted central venous port. That's a tube under her arm to allow her to continue high-level fusions. Not like Mexico, but outpatient procedures. And she has a number of them through the course of the next 9 months. Through the course of this, and with a doctor named Dr. Hanna, who Dr. Kirkpatrick recommended, Dr. Cantu recommended, because frankly, ketamine is incredibly expensive and it's not covered by health insurance. So Dr. Hanna was set up to do these on a regular basis. Oh yeah. Oh, I better get going. Okay, so Maya goes back to Johns Hopkins, and Dr. Anthony Kreisman, who had seen her before the long-term ketamine infusion, quote, ketamine coma, and they commented on how withdrawn and how much pain she's in. Listen to what he says on May 11th after about 30 of these infusions and the long-term infusion. She is a completely different child from when last examined. By that I mean she is not in any pain, she is not moaning, she is smiling and interactive, she is very engaged. She moves spontaneously in her wheelchair without incurring pain. Through the course of that summer, because the ketamine is so expensive, they tried 2 other therapies. One's known as hyperbaric. You can see it right here. Extreme high oxygen content, which has been known to help some CRPS patients. She also tries the IVIG treatment to increase her immune system because it's believed that CRPS can be the immune system may be part of CRPS. And by the end of the summer, she is almost back on her feet. This is in 2016, around August of 2016. Maya is almost back on her feet. We have video of her actually using that as kind of a jungle gym to try to strengthen up her arms and her legs. Everyone is very excited. Everybody is looking forward to Maya getting on her feet. And then she has what they hope to be a minor relapse that turns into a fairly major relapse. And she goes back and has larger ketamine doses with Dr. Hanna on October 5 and 6. And she has some gastrointestinal problems and a lot of pain in the midsection. There are stories that you will hear about her screaming at night. She could not take the pain in her stomach anymore. At one point, the screaming was so intense that the family got a walkie-talkie, so the family could stay all the way over on this side of the house and Maya over here because no one could sleep. So they communicated by walkie-talkie. All right, so they decided on the 7th, October 7th, a key date, to take her to Johns Hopkins ER. Now the reason was that we had Hurricane Matthew tracking up. If you've been in Florida long enough, the hurricanes start to blur together. I believe it's Hurricane Matthew tracking up the eastern seaboard here, getting winds like 35 to 50 miles an hour. To people from Florida, it's like wake us up when it's a Cat 4, and but to the Kowalskis were from Chicago and had never experienced this before. They had visions of like the movie Twister going around in their head, and so all of the ERs and everything were closed, so they took her up to St. Pete to the ER. And Maya is seen by 5 different doctors and groups of nurses and social workers from the ER, and she comes in about 8:46 in the morning, and she's crying and screaming, and she's in a fetal position clutching her stomach, and she is just out of her mind. And the ER doctors there start to react rather negatively to this. Beata comes in approximately 2 to 3 hours later and once again goes through the history, which Jack has been trying to relate, of all of the different visits to Johns Hopkins and all of the different treatments and how everything has failed. And the only thing that has worked has been the long-term ketamine infusions, and we can try this. Can we try that? Can we try a pump? Can we try, what can we do to get our daughter out of pain? For some reason, the doctors there either review all the past records and the some 7 to 8 to 9 prior visits, and the fact that she's had surgery there to have a port implanted to help her with the ketamine infusion. But for some reason, they decide that that isn't it at all. She really doesn't have CRPS. That the mom must be making all of this up. That this is, as a nurse who we think is the one who actually made this diagnosis, Munchausen by proxy. Textbook Munchausen by proxy. Now imagine this is an ER, the child's back there, the parents pulling their hair out, trying to explain to the hospital, this is what Jack will testify to, and Beata is trying to explain to them in an ER where they've been about 5 times before exactly all the history that's going back, that's already in their records, including records from the other hospital. Everything's there. For some reason, the doctors, nurses, and social workers ignore all of that and decide this is not CRPS, that this is the child who's making it up and the parents are making it up, and then this must be child abuse by the parents. And the court has told you that there's pretty much a hair trigger on suspicions, and so they make the call, and that's not part of this case. You're supposed to make the call. Slightest different suspicion, you're supposed to make the call. So that's not a bad thing, whether it was right or not, at that moment. The case is about what happens after that and the failure to diagnose previously so that none has ever happened. Maya, they try to take Maya home after the first night. They're told that they need to observe the child overnight. Fine. But by the second day, Maya is still in pain. They do knock her out with a lot of drugs to get rid of the initial pain. And they give her ketamine. So the next day, she's much calmer. And so then they decide that Maya cannot go home. They decide that taking her home is AMA, against medical advice. And they say, if you try to take your daughter home, we're calling security. So the Kowalskis don't have much choice. They end up leaving. And the next thing they know, they're off for the races and Maya is an unbelievable journey up through and including the death of Beata. Now, what you'll notice in the records, again, the records paint a glowing report of Maya. Just how great she's doing, how much she enjoys things. What a great stay she's having. She's getting this, she's getting that. The only thing she was getting to do was play the piano. Maya knows how to play the piano. She got to play the piano, and she got to draw pictures. And every once in a while, she could send a letter. If she wanted to talk to her mom, it had to be on a supervised call. She could only see her dad and her brother on pre-arranged and monitored situations. If she wanted to see, they hired an attorney, obviously. If she wanted to see her attorney, the nurses would demand that the door stay open. She never had a private moment with an attorney. They're Polish Roman Catholic, which is about as Roman Catholic as you can get. And they have a very close relationship with their priest. So the priest went in to see Maya, and he will testify that when he arrived, he was told that he could not see Maya, and that she had had her religious artifacts taken away. We have a photograph of it. And he asked about this, and they said it's because we believe her mom is controlling her through religion. And so he was not allowed to see her that day. And it took a few other attempts, and then finally he was allowed in, but he was told, no religious procedures. You come say hello, no religious procedures. I told you already about the 42 hours of being placed in a darkened room and told, this is a new type of EEG, Maya. We're gonna really figure this out if this is in your mind or not. No, it wasn't. It was the surveillance room. And again, the goal, because these doctors had somehow gotten confused to think that CRPS includes paralysis. Paralysis is not part of CRPS at all. And yet, they were trying to prove that Maya could actually get out of bed, that she was faking it, that she was sitting in that wheelchair all the time, just, I don't know what reason, but she was faking all this. That actually, when nobody was watching, Maya was getting up out of that chair and walking around everywhere. So they put the commode just a little bit out of reach, right? Figuring, when she thinks nobody's watching, she'd get up, she had to go to the bathroom, go over there. Well, that didn't happen. And you'll see video of Maya having to be carried over to the commode. Of course, her skin started to show the lesions again. Maya started on a dive. Badly getting worse. Depressed. The lesions are forming. You'll see them. Here, now they just may look like scratches here, but you can't see too much of the stuff on the back. What you'll notice through the series of photographs, and thank goodness Dad here took photographs of Maya's lesions, and you'll see those photographs, and I want you to compare them to the medical records, because you'll see on the dermatological reports, you'll see skin normal, and yet you'll have photographs from that day showing lesions. On January 6th, they decided that they needed photographs to prove that Maya really didn't have as many lesions as they said. So they brought someone else in, and we have better pictures. You can see a little bit of Maya's face there. They claim, oh, this didn't bother her at all. There was no authorization from the family, no notification to the family. Maya was screaming bloody murder not to do this because it hurt. They took off her clothes except for her training bra and her shorts, pulled down her shorts, pulled up her shorts there to take photographs of her. Now their testimony is, oh, this wasn't bad on her at all. She was fine with it. No, what she's told is, if you don't let us take photographs, you're not going to see your mom. That's what they told her. So they end up taking photographs, and somehow, where are the photographs? We've only got a few. We do have photographs from the father at the time, however. So, by this point, it's pretty bad. Let's talk just briefly about Beata. During this period of time, Beata is only allowed to talk to her daughter. Hopefully we'll be able to play some of the tapes where we'll be able to hear Beata trying to talk to her daughter. But they put certain things off limits, like, how are you doing? How is your treatment? How is your medication? Things like that. No, you can't talk about that. Not allowed to talk about that. They're the most mundane things you can imagine on these telephone calls. We are allowed to use them. And in those, you'll hear one of the social workers, Kathy Beatty, who was assigned Maya. Now, she was a social worker from one floor, but wherever Maya went, Kathy Beatty followed. And we have the trail of emails and notes leading from notification to the general counsel, through risk management, on down to one of the senior doctors, down to Beatty, about doing this stuff, including what you just saw there in the photograph. We'll prove they knew it at the highest levels. Beata is going freaking nuts, the evidence will show. They find out that Beatty's had some disciplinary problems. They find out, kind of through the grapevine, how bad things are for Maya. They find out about the lesions. Now her feet are completely turned in. And Maya has become so weak, the CRPS has developed to the point where she can't sit up straight. Okay? Now, on the evening of January 7th, Beata, they were going to a party. Jack and Kyle were going to a birthday party, I think. And Beata had been not acting herself at all for a number of days. And she didn't want to go to the birthday party. She didn't really want to go anywhere for a long time. The only thing she did was go to work. She was withdrawn. She and Jack had been having screaming fights because Jack did not want her to be so absorbed in this. He was more of the, let's just try to get her out of there, work her out. And Beata was trying everything. Legal, social, every possible way to get her child out, and her child was not coming out. And she found out through several sources the condition that Maya was in and what was happening to Maya. And on that evening, once they were out, she decided to take some belts and put them together, go out to the garage, make a noose, put a stand below her feet to be able to reach it. She took an IV of saline solution and put the IV in her arm and left a cell phone with a note that said, retribution, retaliation, out. And she left 2 suicide notes, which we'll try to bring before you, telling you about why she did it. It took probably about 22 minutes, according to pathologists, to strangle to death. She'd kicked the stand out from under her. When Jack and Kyle got home, they thought that she was sleeping in another room, which they did a lot, because they weren't getting along, frankly. And so nobody did that. And then Beata's brother was coming in that night. He came in and just went to sleep. Got up the next morning, walked out into the garage, I guess looking for something, and at first he thought it was a Halloween I don't know, costume or something. And he looks closer, and it's his sister, and he, of course, just completely screams out. And Jack comes in, sees his wife with Kyle right behind him. Kyle was, I don't know, we'll ask him how much he was able to see. 911 call made. You'll hear that. And 𝕒𝕒𝕝𝕜 is taken down. We'll have some, we're not going to get gross on them.
Not sure. And they wanted to find out why there was all this horrible stomach pain. Was it appendicitis? Was it a torsion of the intestines? Was there something badly wrong that an ultrasound or a flat plate of the abdomen or a CT scan could detect? Those questions were being asked. Mrs. Kowalski insisted that before there be any workup of the child, she wanted ketamine. Now, not just any amount of ketamine. You're going to hear a lot about ketamine in this trial. Ketamine is indeed an old drug, and it's a drug that is approved by the FDA for use as an anesthetic. It is not approved for use in children, nor is it approved for use in high doses as treatment for CRPS or chronic pain. That's one of the issues here. It's not just ketamine itself, but how it was used and the quantity in which it was used. Because ketamine is an anesthetic, it is an hallucinogen.
You know, the problem with this is that the Children's Hospital themselves ended up giving her ketamine. All right. Then the other thing is, if it actually, isn't approved, if it's actually dangerous or anything like that, then that's on the doctors who prescribed it and the doctors who gave it to her, not on the parents. You know what I'm saying? And the parents were insisting on that just to get her help because that's what they were told. You know what I'm saying? And that's where the disconnect is. If they could have brought in other doctors who knew more, supposedly, you know what I'm saying? If they're saying that the other doctors were wrong, then that's when you bring in other doctors and have them do their assessment. Then you let those doctors go to the parents and say, this is what we have. We know what's going on, and we're going to treat her with something that should actually help. Then you go from there. You know what I'm saying? That you would show her the results. We're giving her something that is approved for whatever other disease we found that she has. There you go. That would have been a more appropriate response. Instead of just, blaming everything on the parents. Because the parents were just going by what the doctors told them. How can you blame the parents for that?
Did well in her father's custody, and she's free to get whatever she wants today. But for the present, let me just mention this. I'll deal more with it. You're going to hear a lot more about it. Once the court entered an order following a report of child abuse that she was to be sheltered at all children's under the custody of the Department of Children and Families, All Children's Hospital did not have the ability to discharge her without court approval, even if it wanted to. You're going to hear evidence. You can hear evidence.
So even with that being said, the court would have been getting reports from the hospital and from the social workers, all right, in order to, get a good picture of what was going on. You know what I'm saying? So here's my theory about this. All right, I could be wrong, but I think once they sounded the alarm and all of these wheels started getting in motion, all right, the further they went down that hole, the more liable they were if it turned out they were wrong. You know what I'm saying? So that could be why, like, they kept sticking to their guns about this. Because they were hoping that they were right. Because then they wouldn't be liable at all. Guys, look, this is a really sad story. You know what I'm saying? So I'm really hoping the family actually wins. You know what I'm saying? And something else that's really odd here is that they're letting the jury actually ask witnesses questions. I've never seen that before. And with some of the questions the jury's been asking, is leading me towards thinking that they might be winning this. You know what I'm saying? The family might be winning. All right. And I hope they do. And one of the biggest reasons why I say that is because not just this hospital in question, but all hospitals, especially children's hospitals, they need to be sure before they start sounding the alarm. You know what I'm saying? They have to be sure. They need to bring in, you know, different experts, get second opinions, third opinions, fourth opinions. Make sure they understand the dynamics and what everything is, and at least have some probable cause to sound that alarm. All right. To me, I could be wrong, but to me, when they sounded the alarm, they had a hunch, just a feeling that this might be Munchausen by proxy, with no actual corroborating evidence to back it up. Nothing. All right. So, all right, that's it for now, y'all.